When occasional alcohol use turns into an addiction or dependence, it can have a major impact on a person's life and health. Even stopping heavy alcohol use can cause complications known as alcohol withdrawal syndrome. In this video, you'll learn about alcohol addiction, alcohol withdrawal syndrome, and treatment options for these conditions. When a person is unable to control their alcohol use, drinking too much, too often, it may begin to cause problems at home, in relationships, and at work. This out-of-control alcohol use is often called alcohol use disorder or alcoholism. If a person with alcohol use disorder either decreases or stops drinking, they can develop a set of symptoms called alcohol withdrawal syndrome. Alcohol withdrawal syndrome is more likely to occur in people who drink greater than the recommended amount of alcohol, 2 drinks a day for men or 1 drink a day for women, and in heavy drinkers who use for long periods of time. It is also more likely to occur in people with a history of withdrawal, chronic medical conditions, other drug use, malnutrition, fatigue, and depression. When alcohol is consumed, it causes certain areas of the brain to work less, having a depressant effect. This results in slowed thinking and muscle movements. A person who drinks in heavy amounts regularly may build up a tolerance to these effects. When the brain is no longer exposed to alcohol, it reacts by having the opposite effect of alcohol, overstimulation. These changes result in symptoms of alcohol withdrawal. Symptoms can occur anywhere from a few hours to several days after a change in drinking patterns. Common symptoms that result from stimulation of the brain include tremor, sweating, and headache. These usually resolve within 48 hours as the brain adjusts to the change. Other unpleasant symptoms such as anxiety, irritability, trouble sleeping, and agitation may last longer than a few days. Some people may also experience nausea and vomiting, sensitivity to lights and sounds, and confusion. These symptoms usually get worse 24 to 48 hours after decreasing alcohol use, but gradually go away. Some people with alcohol use disorder may continue drinking just to avoid the uncomfortable symptoms of withdrawal. Sometimes with very heavy drinking, symptoms of alcohol withdrawal can be life-threatening. Withdrawal can cause high blood pressure, increases in heart rate, trouble breathing, and hallucinations. This condition, known as delirium tremens, is a serious situation requiring hospitalization. Seizures are another serious effect of alcohol withdrawal caused by the changes in the brain's chemistry after the alcohol consumption suddenly stops. These seizures can be prevented or treated with medications and require the person to be under medical care. Identifying the condition can be difficult, since people going through withdrawal may become disoriented and avoid seeking medical care. Friends and family members play an important role in recognizing symptoms and getting loved ones the help they need. The earlier treatment starts, the greater the likelihood of a faster recovery from withdrawal symptoms and success at long-term sobriety. When seeking care, a healthcare provider will ask information about drinking behaviors. It's important to be honest about the amount and frequency of drinking alcohol. Friends and family members can be helpful in gathering some of this information. The initial exam may also include a psychological assessment, lab work, and close monitoring of heart rate, breathing rate, temperature, and blood pressure. Most people with symptoms of withdrawal can be treated outside of a hospital setting with close monitoring, such as daily check-ins and counseling. Sometimes care in a hospital or inpatient treatment is recommended for withdrawal if a person has a history of delirium tremens or seizures, the inability to swallow medications, serious medical conditions such as heart failure, severe withdrawal symptoms, addiction to other drugs in addition to alcohol. You may also need inpatient treatment if you have had a previous unsuccessful withdrawal attempt, or you are unlikely to commit to an outpatient treatment schedule. Regardless of the treatment location, a person may be prescribed medications to help ease the symptoms of withdrawal. The most common are a group of medications called benzodiazepines, which includes lorazepam, diazepam, and chlordiazepoxide. As with any medication, there are side effects and complications, including the potential for abuse or addiction. Talk with your healthcare provider about the risks and benefits of using these medications. Alternative medicines may be ordered if you're at risk for abuse. Some people who drink alcohol can stop or decrease drinking on their own, while others with alcoholism need help. If you need help to stop drinking, talk with your healthcare provider or a mental health professional to find a treatment plan that will work best for you. Treatment may include detoxification or detox with prescription medications to prevent withdrawal symptoms, counseling or talk therapy provided by substance use treatment counselors, medicines to help treat alcohol use disorder, support groups to provide emotional support, advice, and guidance. Alcohol withdrawal syndrome is an unpleasant side effect of heavy alcohol use that is both preventable and treatable. Seeking early treatment for alcoholism will provide a greater chance of a quick recovery and greater likelihood of staying sober. Work closely with your healthcare team to develop a plan for success. Talk to your healthcare provider if you have any questions or concerns about withdrawal, medications, and other treatment options.